For the first three lectures, you need on insulin glucagon fast feed cycle. The best way to approach these, after you've gone through the lectures themselves, is really to go to the, say, this is the well-fed state. What's high in the bloodstream? You ask yourself, glucose, amino acids, tags. What does glucose do? Causes the release of insulin. How is insulin released? You got to know some of the details there from the pancreas. How does insulin work? Through its receptor, activating the tyrosine kinase. How does it affect glucose uptake? Okay, those are the ways you want to think about this, the well-fed state. Then you ask, how is insulin affecting metabolism in those four tissues we always talk about? So you go to the liver. What is happening in the liver as a result of insulin action? Focus on the key pathways: glycolysis, glycogen synthesis, fatty acid synthesis. Are things activate? What are these things activated? They're activated. Why are they activated? Glycogen synthase is activated by insulin through dephosphorylation. Glycolysis is activated because of PFK2 being active, producing fructose 2,6 bisphosphate, activating PFK1. That's the kind of thing that is covered in that lecture, in the well-fed state. Then you go to, so look at those summaries at the end of each of the states. This is the organ summaries, charts. Go to the adipose tissue. What is happening in adipose tissue with insulin? Hormone-sensitive lipase is inhibited because it's dephosphorylated. Lipolysis is inhibited. What is happening with glucose uptake? Muscle and adipose tissue both pick up glucose more because of insulin, because of the GLUT4 transporter in muscle and adipose tissue. And so on. Go to muscle, do the same. What's going to happen in muscle? Muscle is going to resynthesize its own glycogen, its own protein, have glycolysis going on. So really do that way, and that's how you want to work your way through these. The second thing you do, once you've done that, go to the fasting state. Before I move on, just remember that the terminology. Well-fed state is postprandial and absorptive. Fasting state is post-absorptive. Okay? Again, you do the same thing. Why is glucagon released? It's released because of low blood glucose. Released from the pancreas. What is it going to do? All the effects of insulin will be gone. Glucose uptake will decrease in these tissues because of the absence of insulin in adipose tissue and in muscle tissue. Glucagon activates, you gotta remember how glucagon works through its receptor. Simultaneously, you have epinephrine that could be released, and it works through its own receptor, the beta-adrenergic receptor. So either one of them is going through the respective receptor, is going to activate adenylate cyclase. Okay, so remember what happens with cyclic AMP. Its effects on pKa phosphorylating certain enzymes, and those are covered in that fasting lecture, well-fed or fast cycle. So make sure you pay attention basically to the bypass enzymes of gluconeogenesis, affecting glycogenolysis, okay, increasing glycogenolysis. Remind yourself of what are the precursors of gluconeogenesis. Lactate, amino acids, and their respective keto acids. The glucogenic amino acids. Where are these amino acids coming from? You're not eating, so they got to come from somewhere else. They're coming from muscle protein turnover. So those are some important key things to recall. Once these amino acids are released in the bloodstream, they're going to go to the liver through transaminases. Let's take alanine. You go alanine, transaminase, you get pyruvate. Pyruvate can become glucose through gluconeogenesis. Okay, so make that complete circle if you want. Similarly, lactate from exercise or anaerobic glycolysis, you send to the liver and it will be converted to pyruvate, then to glucose. So pay attention to those things. Again, look at that each summary slide, what's happening in the liver. Remember, the liver is doing glycogenolysis, doing gluconeogenesis, doing ketone body synthesis, then what's happening in adipose tissue and so on. I'm not going to go through all the details of each tissue, but that's all in that fast feed lecture. Okay,